Excited to kind of bring this forward. This is now almost a year in the making. So this is a piece of policy work that we began before COVID. I worked with a group of both internal PPS staff, so all three of our high school nurses, one of our high school social workers, and two of our high school administrators, and then a great group of public health staff from the city to revise our tobacco and vaping use and possession policy. So I'll present briefly tonight just a little bit of the context of what led to the proposed changes, what those changes are to the policy that we had up for a first read this evening and will be up for approval next week, and then to share for information some of the changes we made to the related procedure as well. So first, the changes to the policy were initiated in part and substantially because of kind of the piece of legislation that was passed in the spring of 2019 when, the legislature passed that significant, number of bills. So that had led to a number of changes in policy that we've been catching up with. And so one of those, LD 159, was an act to prohibit the possession and use of electronic smoking devices on school grounds. So certainly legislatively catching up to all of the kind of public health concerns around vaping. And so the text of the legislation essentially prohibited the use and possession of any tobacco product, including electronic and vaping products, really at any time. So that was somewhat of the genesis for revisiting this policy. And so, in the actual policy, what you'll see in terms of changes essentially are those that kind of conform with LD 159. So there is the explicit inclusion around vaping and the defining of electronic smoking devices, and then the kind of unequivocal stance around being a tobacco-free environment for, and kind of as it really communicates there, anytime. So and there was specific language around that being kind of 24/7, 365 days a year, anywhere. So on any school grounds, in any school buildings, at any school events, using any kind of district transportation, were call outs specifically that were required. And then by anyone, so students, staff, visitors, anybody kind of on school grounds. So it just makes clear this declaration, both for public health and for cleanliness, that, our school communities will be tobacco-free communities. And that now includes the definition for vaping. So those are the primary policy updates. I'll flag that some of that language as allows us to access resources through our partners with the Public Health Department and the Maine CDC to be able to do some of the kind of education and prevention work that's associated and kind of implicated in the changes in the procedure that we'll talk about. So that includes, given that the language of our policy, which it does meet, kind of the criteria from the CDC as being a good policy, it allows us to access additional signage and so forth that we'll be able to use to help kind of implement this policy. So I'll summarize briefly as well some of the changes. So while we're at it, certainly took a step back to look at the procedure that accompanies the policy in terms of the enforcement of it. And we recognize there were a number of, kind of shifts that we wanted to make to bring it in alignment with, some of our approach to our other policy work. So specifically there, was little about kind of the education and prevention aspects. And then most significantly, kind of the responses, particularly for students, were, really treated it primarily as kind of a discipline and, kind of punitive approach. And there were inconsistencies kind of across grade spans in terms of, whether, how many incidents it might take and what kind of disciplinary response would be. So it was, more stringent at the middle school level, unclear why for us that would be true versus at the high school level. So we sought to kind of clean that up and bring a bit more of a kind of public health, substance abuse approach to this. So, so that we're trying to make sure students have access to resources to, to not engage in the behavior, from a health perspective. So some of the changes in the procedure that we have articulated are, kind of call outs in terms of partnership around the Tobacco-Free School Initiative. And then again, inclusion around within our health curriculum in terms of raising awareness around kind of the vaping and tobacco use. So those were some of the additions there. And then in responses, we had a fairly significant revision here, again, from kind of this distinction that had been in the prior procedure that laid out kind of like first incident, second incident, and third incident and disciplinary consequences, to have a process that's kind of called out when there is, when a student is either found using or in possession of, tobacco, vaping, or kind of related paraphernalia, where there's a process for kind of assessing what's happening for the student. Is this just kind of their first incident? Are they a chronic user? And developing a response plan, ideally in partnership with the student's family, and leveraging some of the resources that we have at our schools, and in partnership, other tobacco cessation resources that we can refer to. So, and there are still, kind of the opportunities or avenues for potential disciplinary consequences as appropriate. But some of those can be mitigated by participating, is what it's called out, in some of the response plan, because really our aim is to ensure students are not engaging in the behavior and getting, support around, their use and their habits, more so than addressing it through a punitive approach. Wanted to call out, just because we have it on our docket to continue this work this year, that there is, a clause in our policy about when students are caught distributing, any, tobacco, vaping, or related paraphernalia, that there is language currently in there that says referral to law enforcement for distribution. So we'll be looking at that. That's one of the policies implicated in our review around kind of law enforcement related policies. So we may come back to that piece, but I just wanted to flag that as well. The responses for staff do follow, somewhat of a progressive discipline approach, so that, staff is kind of given warning, and then those, if the, kind of behaviors continue, but from a staff perspective, adult perspective, that we would, kind of elevate the levels of potential discipline, but also make available cessation resources for them as we move through. And then just kind of some language around how we would treat visitors who are in violation of the policy. Lastly, the procedure, includes some, responsibilities on our part to ensure that we have updated language in our student handbooks, and as well as, this language reflected on our district website and our school websites. So these are, kind of the changes that are, proposed. We had reviewed this through the policy committee back in March, and it had just been approved at kind of our last policy committee meeting prior to shutdown and the kind of onset of COVID. So this had been tabled for some time, and just kind of trying to catch up with the loose ends of our work, have brought it back forward to finally get it adopted and moved forward as kind of the policy that governs, how we'll respond to these issues moving forward. So that's the end of the presentation, kind of overview of the changes this evening. So happy to take any kind of questions or discussion.
Thank you, Aaron. Can I ask just a quick question on the slide before the one that we just had up? Yeah. When you, I just want to look at it again. I'm sorry, because I don't have it up on my computer.
Yeah.
Yeah. On the when we talk about the one before this one, actually, yeah. That when we say that the on the bottom one, that anyone, the students, staff, and visitors, did the policy before not include staff and visitors? I'm just wondering.
No, I believe somewhat going off the top of my head, but I do believe it did. Okay. So I think it's clarity. I think some of the key changes were kind of the anytime and anywhere, as I recall. Some of the things that they were looking for in the updated language. and specifically, called out, buses and transportation as areas that had not been addressed previously in policy and needed to conform to the new legislation.
Yeah, it is in the current policy. It does cover staff visitors.
Is there anything statewide as far as like vaping or smoking in school that we should be aware of?
What do you mean by state, like, or what are you thinking?
Like, yeah, I guess just either guidance or any other, just anything else that would apply that's more on the legal end. Like you said, we call law enforcement for distribution. Is there any other like legal aspect? Because it's for a minor, it's illegal to purchase and carry this, right? So I'm just wondering, is there anything else that applies that we should be aware of?
Yeah, certainly. Yes, it is, illegal for those folks. But I think, our policy does not mandate a referral, for these kinds of, simply use and possession. And, I think that's aligned with our stance that, we want to treat this as kind of a public health issue as opposed to that. And that does not conflict with any kind of state. I checked around the law enforcement provisions with Drummond, and that doesn't conflict with any kind of state requirements that we have.
Yeah. Okay, that makes sense. Adam.
Thanks. Surprisingly, I thought this was going to be like, great, thank you, and easy, but I've actually got things that have come up for me. This is a little bit more of my thinking, some questions baked in, and I will be terse as I always try to be. This is tricky. We're trying to balance the tobacco-free, which I support, with a powerfully addictive drug that's been specifically formulated to target people and a predatory industry. And it seems like we're balancing that public health with some balance of like trying to support people with the addictive qualities of this drug, but also some sort of penalty process for the individuals that are, being impacted by a predatory industry. So to that effect, I'm glad to see that you flagged the law enforcement referral that's in here for further review. I'm curious if there's any analysis of who in our students is more affected by tobacco use, by race, class, that sort of thing.
I don't know off the top of my head. I wonder if the MIHA survey, the Maine Integrated Youth Health Survey, so I can follow up on that to see if that's a data point that might inform that.
Yeah, and that's my only concern is the disproportionate impact on certain groups of students that would lead to further disciplinary issues and our disparities there. And then, of course, the other, any engagements with law enforcement that this is tricky. But thank you for the good work and getting us updated. That's my note and question.
Thank you.
Thank you. Ms. Bondo?
Yes, thank you, Chair. My question is exactly what Mr. Brock just asked for. So if we can have a good data who can really backing up those that policy around different grade and race, who the student who used the tobacco and vaping, and are the way we proceed and going to the disciplinary, because I just want to try to balance the new policy that we want to adopt to try to compare what you have done already, what we have done to try to minimize the use of the vaping and the tobacco. If we can get more analysis with that by grade and race, and also what kind of approach and what kind of disciplinary action we've been taking for that. So I will be appreciated.
Sure.
Thank you.
Ms. Morioni?
Thank you. Thank you, Aaron, for for laying out all the work on the policy. And I just would like to request that the next policy that should be updated needs to be the student drug and alcohol use policy, mostly because it hasn't been updated since 2013. And in that, as you probably are aware, I see you shaking your head, yes, is the language in there specifically around the school resource officer or other appropriate law enforcement authority shall be notified of violations of this policy. So we have some work definitely in this area, as well as the procedures for that, because it's fascinating to me that this policy falls under the A policy book, and the drug and alcohol use is under J for students. So, and wellness, and it's just fascinating. So I just wanted to raise that, and it sounds like you're already on top of that plan. But also because with vaping, it sounds like marijuana now is also being vaped. And so it's hard to determine whether it's, vape chemical or marijuana. So it's technically, it crosses a gray line into drug use too. So, so thank you for shaking your head. It looks like you're already prepared to work on that next.
Yeah, just a couple of quick comments there. Even when we were doing this, we were, looking at that's policy JICH, if I believe, the substance use policy. So yeah, flagged at that time, needed to kind of do some alignment in terms of our approach of trying to have I don't want to say public health, but just a substance use and abuse, approach to it that was consistent, to Board Member Burt's, that, tobacco, our recognition of tobacco and nicotine as a highly addictive drug, we should be consistent in terms of our approach to those kinds of issues. So that was flagged then. It's on our work plan as a stretch goal for our policy committee this year. And so it's on the docket. We have a number of meaty things we're working through, but on the agenda to get to.
And can I just address the issue of why the tobacco vaping is in A and the drug and alcohol use? I'm not 100% sure that it needs to be that way, but the A policy applies to students, staff, and visitors, and the other one, the J applies only to students. And there are different rules around alcohol and now drug use in the state, depending on the age of the person. So.
All right. Thank you. I'm sorry, Aaron, go ahead.
No, just, I'll do some follow up on that, the couple of questions about the MIHAS data and kind of some summary of what our disciplinary kind of data has been as it relates to instances of tobacco and vaping for our, when we come back to this for second read next week.
And I believe the MIHAS data will only have race if we look at it at the county level. We won't have it at the district level, but we can definitely look at our own referrals and discipline in our discipline data.
Okay. So I don't see any other hands raised. So I don't think we have other questions. This covered everything, Aaron, from the policy end, right? So,
yep.
So if we don't have anything else, you guys are ready to call it a night? All right. Thank you all. I'll see you guys next week. Some of you later on this week at some point, I'm sure. Javier, I'll see you tomorrow. Have a good night. Thank you, everyone.
Thank you so much.
Thanks.